mentioned in the group that today we will be discussing about handling aggressive patient party. So if I may ask all of you, how often do you come across aggressive patients in your setup? Dr. Atul, you have to unmute your device.
Yeah, sorry, sir. Rarely. I think once in maybe 6 months or so.
Mm-hmm. Yeah, because I've visited both the places, HVDSI and NNN. I didn't see the culture where the patient would be aggressive with the doctors. I think they have a lot of respect and a lot of that. What do others say? Dr. Snehal, Dr. Varsha, have you experienced? Dr. Varsha, there is some challenge in your video. Is it for me or for everyone? It's flickering. There are a lot of.
Yeah, it's flickering. Now it's stopped.
Yeah, it's fine. Yeah. So, what is Dr. Snehal's your point of view, or Dr. Varsha's your point of view?
Definitely, ma'am. I come across this kind of this experience, but in our institute, it's not that much. Means once or twice in a year, maybe.
So, can you recollect any reason? I mean, if you're saying it's once or twice in a year, any incident that you remember that happened in the last 6 months or 1 year? Anyone of you, Dr. Atul or Dr. Snehal, anyone? When Dr. Varsha, in case if you remember any case where you personally experienced,
many times due to the long waiting period, the patient gets annoyed, and they don't become violent as such, but as such, if they have to come for the frequent follow-ups, and if they doesn't have the opportunity to meet the doctor to whom they want to meet, then at that time, once or twice there was a situation the patient had become violent, and we have to activate the code violet also.
Achha, okay.
Yeah.
So
But it was
started fighting with the doctor or with the receptionist or the person who was coordinating?
No, first they started fighting with the staff, attending staff, and later on everyone has to was the part of that.
Can I request others to have their Yeah, sorry, I have muted everyone. Yeah. So sorry, Dr. Varsha, could you repeat? So I got distracted with the sound. Yeah.
Yeah, so the first staff was involved in that. The attendant was involved, and later on everyone has to take a call of that patient and has to satisfy him with whatever and has to solve their problems.
So like did he damage something? Did he damage something? Did he hit somebody?
No, not that level, ma'am. It was just
loud voice and shouting and
yes.
Okay.
And once there was a post-op patient, but they had a fight among their relatives only. Some issue was there, and they had a fight among their relatives. Yes.
Okay. But then, of course, nothing happened to the hospital staff or the hospital.
No, nothing. They have activated code violet, ma'am.
Okay.
So everyone get sorted.
Actually, ma'am, we haven't experienced any very aggressive patient till date.
Yes, correct.
Yeah, I've been seeing over many years now, almost 15, 20 years, but we haven't seen a very aggressive patient who destroyed hospital property or who injured someone. Like this situation, we haven't got yet. Fortunately.
So you are very lucky. You are very lucky. Yeah. And credit goes to, I think, the way you are conducting yourself. I've seen all of you in the hospital setup, working with your patients. You are all very cordial, very respectful with the patient. I see your staff also very, well-behaved, very, if not very welcoming and very proactive, but at least they're cordial and respectful. They don't ill-treat the patient. They're not rough with the patient. That's very important. But the way things are changing, you never know when you may come across any situation. Like last time, Dr. Silva was talking about that patient who sued them, who took that to consumer court. So we do have such random cases also where patients become not only angry, but they go to the extent of filing a case against the doctor or the hospital. I think all these are very unpleasant experiences. So I'm glad that you haven't experienced it personally. And as you said that you handle it. So is this staff trained in any way in case if they see any misbehavior or any loud noise? This is the protocol they have to follow. Do we have any such system in place?
Yeah, we do activate code violet, as Varsha has already told you, ma'am. And so the code violet, the security staff comes in immediately.
Okay.
The security staff, they are trained, and the OPD managers and everybody, the senior people also do come.
Mm.
And then it was not really something like I told you, destroying the property or sort of. So they just had to calm the patient. That was the thing they had to do.
Mm-hmm. So maybe today's session will, maybe because you're not handling a lot of aggressive patients, so maybe you'll think that this is just for your learning purpose, but then of course there's nothing wrong.
No, but we may get a situation, yeah.
We may get a situation. And more than that, I think a lot of time patients carry that grudge within themselves and they go and defame and talk ill about us. And if they're educated, they may even go to Google reviews and write, poor comments on our conduct or our delivery. So even that's not desirable now. We know it does a lot of damage to the respect of the hospital and also the reputation of the doctor. So it's important to understand how we can actually prevent aggression, and then you never know which case might turn into a very serious kind of a situation, because nobody comes with the mindset that they're going to hit the doctors or the hospital staff or going to break the property. It's in the moment that, the heat of moment, they don't know how to react. And usually the reaction is usually overreaction. Later on, they may repent or they may come and even apologize. But that's later on. In the moment, I think usually people don't realize what they are doing. So should we do a small, role play on it to understand how we handle and how differently can we handle? So can I request everyone to come in to have their cameras on? Dr. Varsha, Dr. Vilasha, Dr. Ashwini, Dr. Snehal, because we need people to do the role play.
Ma'am, can you repeat once?
So we will do a small role play on it because it's important to learn to handle the patient party. So we need 3-4 people. So maybe a person to act as a doctor, other one. I think it's not the patient usually, it is the patient's attendants who become aggressive. Yes, I think that's the situation. So can we have other people? Last time, I think Dr. Varsha did the role play and Dr. Atul was the patient. So can we have somebody else doing the same this time? Dr. Vilasha, Dr. Snehal. I think Dr. Snehal lost the... She needs to log in again. Dr. Vilasha, are you there? Dr. Ashwini?
Yes, ma'am, I'm here.
So can I request you to come in?
Yeah, yes.
You have your camera on.
Today I'm struggling with my laptop a lot. Hello, ma'am.
Hello. So I hope you heard the discussion we had a minute ago.
Yes. So I heard about the being from the same hospital, conduct the same protocol that code violet and. But I do remember such incidences from medical college, like Sassoon Hospital and everything.
So can you narrate any incident that you remember?
Yeah, so a lot of time it is pretty common when you consider in medical that people get referred from multiple stations, most periphery to taluka place, then taluka to Jilla to Pune. And all the regression keeps piling up. And suddenly when patient reaches a government medical college and they don't want to hear a bad news, or they want that we are coming from so far, and now you attend my patient first.
Oh, yes.
And there are like 20 other patients who need priority, like triage system and everything. But they don't understand that they are, as you said, they are in the heat of the emotion. And all 20 people coming together, like all the relatives, are not with the same mentality. Some are young blood, and they are like, we should be the priority. And why you are not giving attention to us. So I have seen a lot of times that my medicine and surgery colleagues got hit by like either punch or like abuse and everything. Even we saw that casualty, like there was destruction of all glass windows and everything. So it was, now we laugh at those incidences, but at that time it's literally people, it's very sad situation, unfortunate situation, that people have to run for their lives, that you don't know, you might get hit at your eye or your face or something, and that's pretty bad situation. So, and often in medical colleges also nowadays they are giving training how to handle a mob, what can be done to handle a mentality of the mob. And not just the human resources are not just the option, but how do you tackle and how do you talk to them?
That's very important. I think that way this session is going to be of great help to all of us, because we're going to have a deeper understanding of that. Why do people become aggressive? And if we can prevent those things from happening, I think we can mitigate situation at a much earlier. Yes. So this is what we are going to discuss. So we can take any situation like Dr. Abhilasha shared about the medical college, or we could take any situation from the present hospital. That you maybe, like for example, you have operated a patient and you have charged quite good amount because you put multifocal lens and you were sure that you will get a good result. But unfortunately, the patient vision hasn't come at all for any reason. It could be vitreous hemorrhage or loss of. So and the family is very, very aggressive about it. Like the sons of the patient are very annoyed because they expected very good vision for their parent, and now they are disappointed. We can take even this situation if you want, and they're very aggressive. Would you like to enact that play? So Dr. Abhilasha will be the consultant this time because
okay. I thought you were saying, will you be the angry patient? Okay.
You can do that if anybody else is ready to take the. That's yeah. So who would play the patient's attendant? I want two attendants, very aggressive one.
I think recently Dr. Atul handled similar situation, isn't it, sir? Like, not recently, but couple of months ago, when that patient was post NA and multifocal, and she was crying in front of us. So
no, but that was not an aggressive behavior. She was emotionally.
I said,
but we want aggressive patient party now because we want to understand.
That was not aggressive.
That was emotionally aggressive.
Because they were unhappy, dissatisfied. Yeah.
She was crying for the. She was very nice. Still, she was not happy.
Who can be aggressive patient party at this moment? Dr. Snehal, you choose to be? Okay.
Ma'am, I don't think so. I can be that aggressive, but I'll try.
But we want everyone to experience even the patient's plight.
Okay.
Sometimes, even playing the role of patient or their family, you get to realize it's not that comfortable for them also. So Dr. Varsha and Dr. Snehal, you are daughters of the patient whom Dr. Abhilasha has operated.
Oh my God.
Unfortunately, the results are not as expected or as they were kind of assured. And now you're very, very dissatisfied. You want the money back or something to be done. And let's see how Dr. Abhilasha manages you. Okay.
What is the situation? What surgery has been done?
Maybe you can say cataract surgery. Let's take a simple situation that you can relate with.
Okay, so let's take a simple situation that recently the actual situation, like patient got multifocal and she was already prone for NAION. She had all diabetes, hypertension, all serum homocysteine was high, and post cataract surgery, she developed NAION and her vision is currently 615, but she is not happy with that 615. And saying, oh no, sir, sir, this was a situation, right? Similar.
Yeah.
Okay. So I think we'll close our videos.
We don't have any patient along with us, no?
No, patient is outside, or maybe,
Yeah.
but normally patients don't speak much. It's the family
Yes.
fights. Normally, we have seen this. No? So Dr. Atul and me will put our videos off, and we'll come back. And you require 2-3 minutes time. Is that okay?
Yes.
Oh yeah, more than sufficient.
3 minutes. Okay, thank you.
ये अभिलाषा मैडम कहाँ मिलेगी? कहाँ है वो? कहाँ है अभिलाषा मैडम? You please call her. You please call her immediately. I want to meet her.
What has happened? What has happened? Yeah, I'm the Dr. Abhilasha. Please tell me what has happened. Let's sit inside. Sit inside.
Okay, you are Dr. Abhilasha.
Yes, I'm Dr. Abhilasha.
You have operated my mother.
Sorry, I don't know about your mother. May I see?
You don't know. You have operated her and you don't know.
No,
we have paid a lot, so much money, and you don't know.
No. So
How can this happen, Dr. Abhilasha? How can this happen?
Let me see the case.
Tell me, what is the situation? You are saying, you are telling that you don't know the patient.
So I think last time your other sister was accompanying the patient, so we haven't met.
I was there.
Yeah,
yes. Okay, and I am there now.
Oh, mother is suffering from the situation.
Yes, of course.
Yes. So let's talk. What is the issue at present? So what is your main complaint? What is she suffering? Do you think?
She can't see at all right now.
Okay.
And she's complaining to us throughout day and night.
Okay. Let me go through your case sheet. Okay, I have gone through your case sheet, and what I understand is it's been 1.5 months post-operative, and her vision. Let me tell you that I agree her vision is not up to the mark what we usually expect, but it's not like that she cannot see. Her vision is very, very much better. We call it as 615 in our language.
मैडम हमको ये पता नहीं 615 क्या है, हम ये समझते नहीं है. हमें सिर्फ चाहिए पेशेंट को विजन आनी चाहिए. आप हमें क्या बता रही है 615? What is 615? We don't understand. What is 615?
I totally understand.
आपने तो बोला था कि 100% विजन आएगा, और आपने तो बोला था कि नियर का भी आएगा. तो
मेरी बहन लेके आ रहे हैं उनको.
Reading anything.
3 बार विजिट हो चुकी है हमारी. हम कहाँ से आते पता है आपको? और आप बोल रहे हैं हमको पता नहीं कौन पेशेंट है. This is not the way, ma'am.
So let me tell you, see, each surgery has its own complications. So जब भी we don't promise that 100% you will get a vision. There are always you sign a consent.
पहले बताना चाहिए था ना मैडम. मेरी बहन कब से उनको लेके आ रही है. इस बार मैं लेके आई क्योंकि आप उनको कुछ बता नहीं रहे. वो भी परेशान है बेचारी. आप पेशेंट को भी बता नहीं रहे, उनको भी कुछ बता नहीं रहे. अब हम क्या समझे?
किया है, like we have explained the patient that because of her own medical conditions.
आप हंस रहे हो मैडम.
Sorry, let me.
कंडीशन इतनी पुअर है और आप हंस रहे हो.
फैमिली मेंबर
क्या करने का इनका? मेरे तो कुछ समझ में नहीं आ रहा है. स्नेहल आप बताओ, आप ही बोलो इनसे.
आपने तो बोला था मैडम, मैं थी लास्ट टाइम उनके साथ, तो आपने तो बोला था अच्छी नजर आएगी उनको, बढ़िया नजर आएगी. तो यू तो प्रॉमिस 100% विजन. आप तो बोले थे कि नियर का भी देखने को मिलेगा. वो तो ना बुक पढ़ पा रहे, ना कुछ भी पढ़ पा रहे, ना न्यूज़पेपर पढ़ पा रहे, और दूर का भी
हमें भी परेशान कर रहे. वो हम हमारे रूटीन डेली रूटीन कर नहीं पा रहे मैडम. सुबह शाम हमें परेशान कर रहे. वो क्या ऑपरेशन किया, क्या हुआ हमें समझ में नहीं आ रहा. और आप 615 बता रहे.
और कितना मनी स्पेंड किया हमने. हम तो इतने अफोर्डेबल भी नहीं थे, फिर भी हमने कुछ तो किया मैनेज ताकि हमारी माँ को अच्छा दिखे. और अभी आप हंस रहे हो.
So let me
हमने
finish.
दूसरों से पैसा लेके ऑपरेशन किया है मैडम, और आप बोल रहे आपको पता भी नहीं है.
Now I heard your side. Let me say something regarding the patient. Okay. So this is not something कि operation की कोई गलती हुई है. This is something systemic जो कि आंखों से related नहीं है. पीछे की नस को सूजन है, और वो सूजन आ सकती है हर वो पेशेंट में जिनको डायबिटीज है, हाइपरटेंशन है, जिनकी नसें वैसी ही बनी है. तो ऐसे नहीं है कि ये पहला किसी पेशेंट है, या फिर ऐसे नहीं कि ऑपरेशन करते वक्त सर्जन की कुछ गलती हुई है, लेकिन पीछे
मेरी
की
मासी को ही ले लो मैडम, उनको तो बहुत बड़ा डायबिटीज है, इनसे भी ज्यादा है, लेकिन उनको तो सूजन नहीं आई, फिर इनको क्यों आई?
As I said, हर किसी पेशेंट में आना स्वाभाविक है, लेकिन अगर आप कितने पेशेंट रेफरेंसेस है कि जिसमें कि 10 से 15% पेशेंट में ये हो सकता है, तो ये किस में हो सकता है, ये बहुत रेयर है. लेकिन जो हो चुका है, दैट इज नॉट बिकॉज ऑफ कॉम्प्लिकेशन ऑफ सर्जरी, दैट इज बिकॉज ऑफ सिस्टमिक थिंग. वो वेजिटेरियन है, इसलिए हमने वो ब्लड टेस्ट की जिसमें कि बहुत ज्यादा आया सीरम होमोसिस्टिन. तो ये आपको पहले भी एक मेडिकल डॉक्टर ने बोला था कि इसकी ट्रीटमेंट लेनी चाहिए, लेकिन समहाउ आपको शायद वो लगा नहीं होगा कि उसके इम्प्लीकेशंस इतने ज्यादा हो सकते हैं.
नहीं, बट मैडम आपने बताना चाहिए ना पहले कि कैसे इम्प्लीकेशन. तो हम जाते ही नहीं है, हम दूसरों से लेके ऑपरेशन किया है. बताओ स्नेहल इनको
अभी
कैसे सिचुएशन से जा रहे हैं.
के वक्त भी, दूसरी ऑपरेशन करते वक्त भी देयर आर इक्वली सिमिलर चांसेस कि ऐसे हो सकता है. हर किसी पेशेंट में हो सकता है. जिन में ऐसी नसें है, डायबिटीज है, हाइपरटेंशन है और पेशेंट विजिट है, हर किसी में हो सकता है. तो इसमें कोई भी पहले से प्रेडिक्ट नहीं कर सकता, या फिर कितने भी अच्छा सर्जन ने कितनी भी अच्छी लेंस डाली, सिंपल सी लेंस डाली होती तो भी हो सकता था. इट्स नॉट कि बाबा आपसे मल्टीफोकल डलवानी थी. मल्टीफोकल डालना या कोई भी डालो, ऑप्शन हम हमेशा पेशेंट को देते हैं. लेकिन
बट मैडम ये पहले भी होगा ना, ऑपरेशन के पहले भी होगा ये कंडीशन, या बाद में हुआ है?
पहले
तो कुछ नहीं बोला आपने ऐसा हमें.
आपने तो अभी बोला ना, ये उनको फिजिशियन ने बोला था कि उनका ये लेवल बहुत ज्यादा बढ़ गया है, तो वो तो रिपोर्ट आपने पहले भी देखा था, तो आपने तभी बताना चाहिए था कि वो लेंस.
हाँ, आपने तभी बताना चाहिए था मैडम, हम सोचते थे फिर
तो हम दूसरा बिठा लेते.
यस करेक्ट.
ये रिपोर्ट आपने अभी जो फाइल लेके आए हो उसमें है. Ma'am,
sorry Abhilasha, sorry.
Like my husband and my nanny came outside thinking that somebody is fighting with me, and they're standing in front of me. Who is fighting?
Sorry. Extremely sorry.
I'm telling
Dr. Varsha surprised all of us.
I literally told me, you go away.
So you can assure them it was just a role play.
Ma'am, you gave me two people to fight, and I'm like, oh my God, I wish I was a patient.
I thought, I don't know if they will really speak up, but Dr. Varsha just broke all barriers and she was on top of the performance. Congratulations.
Thank you, ma'am.
Just imagine, it was a role play, and honestly, both of them were really, on Dr. Abhilasha. If it was a real life situation, when there are so many people around us who are observing, who are overhearing all this, we also get emotionally involved in that situation. We are very perturbed, very scared, by the way, what are the common emotions if you are in a real life situation that you think you will experience?
Anger.
That is one, of course, because you did your best and now you are being blamed for poor performance or poor result. Absolutely. What do others say?
Feeling of that we got deceived. Like,
you're talking on the patient's behalf or the doctor's behalf?
No, patient's behalf.
I'm talking about the doctor's behalf first.
The doctor's behalf. Okay, yes. Yeah. Is sometimes you feel impatient when you don't get a chance to talk. You don't get a chance to give what are the facts. Yeah.
So that means I need to have that kind of, control where I can say what I want to say without being authoritative or without. I have to learn that skill. Yeah. Dr. Sabyasachi is still shocked at the And
I had actually joined in the middle.
I know.
And then I did not realize what was happening. And then she started laughing. And I switched off my video.
I started laughing because the both people stood in front of him. Who is fighting with you? I was like, I remember this throughout my life.
I'm sure they must have not expected something like this. So what other emotions do you think one would experience if one was in Dr. Abhilasha's place?
Apprehension.
Apprehension of what?
Helpless.
Apprehension of what?
What will happen next?
What will happen?
What next? Yeah. Will they be more aggressive? What will happen next? Yeah.
Wonderful. Will I be able to handle it? Will I be able to calm that down? Will I be able to control this situation? Dr. Sabyasachi said helpless. Why?
Because perhaps this is something that is very difficult to explain to someone who is not in the mood for listening.
That means I really need to have excellent communication to make that person calm down and give me little time to explain my position. Excellent. What do you think would have helped in managing this situation? Could have been done before the surgery, during the surgery, after the surgery? Anything that you can think of?
Yeah, pre-op counseling and written consent about that. So
see, honestly,
we have a proof that we have explained that might be the situation.
Yeah, please go ahead.
Yeah, that might be the situation that will happen to that patient's vision even after doing a good surgery with a good lens. So that is very important, the informed consent prior.
So when we say written consent, I want to just remind you that written consent can help you maybe in the court of law. But very honestly, to deal with this situation, if you will bring that up, they are going to even negate that. हमने पढ़ा ही नहीं, हमें समझ ही नहीं आता, मैं अनपढ़ हूँ, इतना कुछ लिखा हुआ मुझे समझ आ सकता है, आपको आया है क्या लिखा है, आपने कहा साइन कर दो, मैंने कर दिया. So if you will bring that up, this is going to further aggravate this situation. कि आपने साइन करा है, आपको बताया गया है, all that will not help here. Anything else that could have helped? Yeah, you said pre-operative counseling. I agree with you. Giving them very realistic expectation and letting them know the risks and the possibilities very, very clearly. But normally we think patient might run away. But when you tell them about the advantages of getting the surgery done, and if it's a calculated kind of a risk, motivating them to take that chance can help in still sticking with you, but knowing that there is a possibility. Although there's a risk of selective listening, selective attention, that's there. But you still, if you can build that confidence and let them clearly know that chances of poor vision are there, but this is the best option at the moment. What else could have helped? Anything else do you think could have helped?
While Dr. Abhilasha was explaining about the clinical, the only thing I noticed was she didn't say, please calm down, please calm down, please sit down quiet, please listen to me. She could have said that maybe quite often. That thing was...
So Dr. Atul, does that help or it can counter, it can backfire? If you use
but we will have to pacify the relatives, no ma'am? We will have to pacify it.
So that means saying this, please calm down, but your tone, see, assertion, if you remember the last session that we discussed, your tone of voice should neither be threatening nor be pleasing. The moment your tone of voice will be pleasing or pleading, it's going to backfire. The person will not take your words seriously, would think that you are scared now, you're on defense now. If you're saying sorry too many times, or if you're saying please too many times, you have to say there's nothing wrong with using sorry and please. But how much and when and in what way? We are going to talk about that. But yes, asking them to calm down and talk to me properly and listen to me would have definitely helped. Definitely. We are going to talk about it. Anything else that would have helped?
Someone from the hospital authority, which is, don't have to be a doctor exactly, but somebody from the hospital who is expert in this, availability of that person as well, he being there, he or she being.
But Dr. Abhilasha, usually when patients would walk in, they'll come to your OPD and they'll be talking directly to you. So you will not, maybe this will happen in case if you are able to delay the whole, development of crisis, and then meanwhile you are able to press crisis button and have some people on your side. That is definitely one of the steps you need to take. But for smaller issues, I don't think you will always call anybody. And I think individually, each one of us should know how to handle such situation. That's the idea of this session, that each one of us should be empowered to deal with this amicably.
Yes.
Okay. So when the patient said that my mother has no vision, you operated on my mother. And if I say, who's your mother and who are you? Instead, if I say, oh, Snehal, I think you are Mrs. Chatterjee's daughter. Am I right?
Yeah.
Does that bring any difference?
Yes.
Ma'am, I got angry because of that only. Because she said, let me check your data.
If you say, I'm not aware which patient you're talking about, if you're not aware, it's okay. It's not possible to remember every patient's name. And one, I would advise you, please always identify the primary caretaker. And communicate with that person, definitely, because you have already built rapport. That person has some trust in you. The attendant believes that you are doing your job well, of looking after you carefully and as a professional. Plus, it is easy to communicate with the person with whom you have already communicated. So, for example, if Varsha and Snehal came together, and though I don't know Varsha, but I recognize Snehal because I've spoken to her a couple of times before the surgery. So I can say, oh, Snehal, okay, who is this with you? And Snehal says, this is my sister, Varsha. She has come today. She wasn't there. So that means, oh, good morning. How are you, Betty? So showing familiarity will automatically help you calming down. The moment you will call your patient's name or their attendant's name, they'll immediately, first they will feel respected. They will feel, oh, doctor knows my name. And then they also know I have to act responsible. That will automatically happen. So realistic expectations, one, pre-surgery. Second, familiarity with the patient and the attendant. These are two things I think will greatly help you. Of course, overall, Dr. Abhilasha tried her best to deal with the situation. She handled it very well. So very quickly, if we can have a same role play. Now I play Dr. Abhilasha's role, and Varsha and Snehal would be the patient's attendant. And please be as aggressive as you were with Dr. Abhilasha. Don't spare me. So use all your ways to...
I had this in mind, and I was about to request you that we want to see you handling the situation. I had that in my mind.
Sure. So I think we'll just take maybe 2-3 minutes time, not very long, but let's see how we can handle it differently. Yeah. Can I request everyone else to have their cameras on? Thank you. Okay, so assuming that I'm sitting in the OPD and both of you have come in, and before actually the moment you will come, I'll immediately say, Snehal, आप मिसेस चैटर्जी की बेटी हैं, आप मुझसे मिलने के लिए आई हैं, आपके साथ कौन है
ये माँ जी है हमारे नहीं ये बहन जी हमारे हैं, हाँ, तो ये आए हैं आज हमारे साथ।
मैडम आप डॉक्टर इंदु है?
उनको
मैडम आप डॉक्टर इंदु है?
जी
यस। सो आपने ऑपरेट किया मेरे मदर को?
जी।
यस। मैडम उनको कुछ भी विजन नहीं है। आपने तो कुछ पहले बोला नहीं था। मेरी बहन उनको लेके आ रही है कितने दिनों से, उनको भी कुछ समझ में नहीं आ रहा है। हम बहुत परेशान हो गए मैडम, बहुत परेशान हो गए। हमने बहुत मेहनत से कमाए हुए पैसे, हमारे पास पैसे भी नहीं थे मैडम, हमने दूसरों से लिए हैं। उनको दूसरे भी प्रॉब्लम है, डायबिटीज है, हाइपरटेंशन, उससे भी वो परेशान है। अभी उनको नजर भी नहीं आ रहा मैडम, हम कैसे करें, बोलिए आप।
Varsha, I completely understand your point of view and means
और 2-3 बार हम आके गए हैं मैडम, स्नेहल तो वो सब उसका जॉब छोड़ के आ रही है।
मेरी स्नेहल से लगातार बात हो रही है और ऑपरेशन से पहले भी स्नेहल से बैठकर मैंने पूरा एक्सप्लेन करा था कि आपकी मदर के केस में, क्योंकि उनको डायबिटीज भी है, हाइपरटेंशन भी है और कैटरेक्ट भी था, जिसकी ऑपरेशन होना बहुत जरूरी था क्योंकि मोतिया बिल्कुल पका हुआ था। तो कैटरेक्ट की सर्जरी होना बड़ा जरूरी था, इसलिए सर्जरी हमने करी है उनके लिए। पर हमें ये भी मन में था, चिंता थी, और मैंने स्नेहल के साथ शेयर करा था कि विजन शायद बहुत अच्छी ना आए। तो ये मैंने स्नेहल को बताया हुआ था और अनफॉर्चुनेटली हमारे केस में यही हुआ कि सर्जरी के बाद उनकी विजन अभी बहुत अच्छी नहीं है। मैं एग्री करती हूँ, मैं उनको रेगुलर देख रही हूँ।
मैडम मेरे मासी को भी सेम कंप्लेंट्स है, वो भी डायबिटीज है, इनसे भी ज्यादा उनकी शुगर लेवल है, लेकिन उनका तो बहुत अच्छा हुआ। और लेस भी उन्होंने इतनी नहीं डाली मैम। हमने हमारे पूरा, स्नेहल और मैंने पूरा हमारा जॉब, हम भी अकेले रहते हैं मैडम, हमें भी कोई फाइनेंशियल सपोर्ट नहीं है। हम हमारे माँ के लिए जितना कर सके उतना किया है मैम हमने, और वो बेचारी तो जॉब छोड़ के आ रही है उसका।
और मैम तब आपने बोला था कि उनको तो अच्छी विजन आएगी, दूर का भी दिखेगा और नजदीक का भी दिखेगा। आपने बोला था कि उनको डायबिटीज है, पर ऐसे नहीं था कि उनको विजन बहुत कम आएगा या उनको नहीं दिखेगा। आपने तो बोला था ये अच्छी वाली लेंस है जिससे दूर का भी दिखेगा और पास का भी दिखेगा।
हाँ ऐसे ही बोला था, हमारा घर पे उस पर डिस्कशन हुआ था मैडम, क्या करना है क्या नहीं करना है। और हम दोनों का ऐसा हो कि हमें सारे पैसे लगा दिए, लेकिन उनको विजन आना चाहिए, हमारी माँ ने देखना चाहिए, वो इंडिपेंडेंटली सब करना चाहिए।
वर्षा, जैसे आप चाह रहे थे कि आपकी मदर की विजन बहुत अच्छी आए, मैं भी यही चाह रही थी कि आपकी मदर की बेस्ट विजन आए, दूर का और नजदीक का दोनों उनको अच्छा दिखे। लेकिन क्या होता है, जब मोतिया होता है तो मोतिया जो है वो एक तरह से एक सफेद पर्दे की तरह होता है। पीछे रेटिना की और आंख की क्या कंडीशन है ये हम देख नहीं पाते हैं सर्जरी से पहले। इसलिए जो है हम उम्मीद करके चलते हैं कि जब हम ये कैटरेक्ट हटाएंगे तो पेशेंट अच्छा देख पाएगा, और उसी उम्मीद के साथ मैंने आप लोगों को एडवाइस करा इस सर्जरी के लिए। और मैंने ये भी बताया था कि क्योंकि डायबिटीज है और हाइपरटेंशन है तो इन केसेस में थोड़ा सा ये एक रिस्क होता है हमें। मल्टीफोकल लेंस जो मैंने एडवाइस करा उसका पर्पज ये था कि बुजुर्ग है, चश्मा ना पहनना पड़े, बहुत अच्छा रहेगा, दूर का अच्छा दिख जाएगा, नजदीक का अच्छा दिख जाएगा। और लेंस एक ऐसी चीज है कि ज्यादातर जब हम एक बार डाल देते हैं तो अमूमन केसेस में हम दोबारा नहीं डालते, वो एक बार ही डल जाता है, वो जाके फिट हो जाता है।
मैडम
तो
आगे क्या करना है आप बताओ, अभी हमें आगे क्या करना है, हमने हमारा प्रॉब्लम कैसे सॉल्व करना है।
मोतिया पक गया था तो सोनोग्राफी भी करा लिया था, उनका सोनोग्राफी तो अच्छा आया था, इसलिए तो ये
सब कुछ
ऑपरेशन
किया था
कराया।
मैडम।
फिर भी पीछे का जब तक हम देख नहीं पाते ना स्नेहल, नहीं बता पाते। हम देखो, अब मैं क्यों चाहूंगी कि आपके पेशेंट का नुकसान हो या आपका नुकसान हो। सर्जरी वाइज उसमें कोई कमी नहीं है, अगर आप चाहें आप कहीं और भी दिखा सकते हैं। मैं आपको पूरी डिटेल में दे देती हूँ, पेशेंट आपके पास है, आप कहीं किसी दूसरे आई सेंटर में भी जाके दिखा सकते हैं।
नहीं
लेकिन
मैडम हमें दूसरे पास नहीं जाना है,
पर
आप बोलिए
हमने
हमें
ऑलरेडी
आगे
वहां
क्या
पे
करना है।
बहुत खर्चा किया है, अभी और एक डॉक्टर के पास
नहीं कर
जाएंगे
सकते
तो
हम,
और
खर्चा सही में
मैं
नहीं कर
होगा।
सकते।
देखो, मैं कभी भी आपको कहीं और भेजना नहीं चाहूंगी, अगर जरूरत नहीं तो मैं नहीं भेजना चाहूंगी। लेकिन आप मेरी बात पर विश्वास कर सके, इसलिए जरूरी है कि अगर आपको तसल्ली हो, चाहे तो किसी और डॉक्टर को दिखाकर भी आप तसल्ली ले सकते हैं। लेकिन इस केस को पूरी तरह हैंडल करने के लिए मैं तैयार हूँ, और हमारे पास पूरा सिस्टम है। मेरे पास रेटिना स्पेशलिस्ट हैं और डॉक्टर्स हैं जो कि इस चीज के स्पेशलिस्ट हैं, उनकी हम सलाह ले सकते हैं, उनको हम दिखाकर जो भी बेस्ट पॉसिबल ट्रीटमेंट है वो हम करने के लिए तैयार हैं।
मैडम इसका कुछ ट्रीटमेंट है क्या, अभी नजर आएगा क्या उनको, अभी तो भी आप बताइए, आप नजर आएगा क्या उनको।
आप देखो, स्नेहल से पूछो, डे 1 से लेकर अभी विजन में इंप्रूवमेंट है और हम उम्मीद करते हैं कि इंप्रूवमेंट होगी। अब अगर इसमें आप मुझे कि कितनी इंप्रूवमेंट होगी, मेरे लिए कह पाना भी मुश्किल है। हम कोशिश कर सकते हैं, जो भी ट्रीटमेंट प्रोटोकॉल्स है वो पूरे फॉलो किए जाएंगे। जो जो स्पेशलिस्ट का देखना जरूरी है उनके पास मैं रेफर करूंगी और वो देखेंगे, और ऑलरेडी दिखा भी रही हूँ मैं उनको, मैंने भेजा है उनको, रेटिना स्पेशलिस्ट के पास भेजा है देखने
मैडम
के
अभी
लिए।
कितने बार आना पड़ेगा हमको उनको लेके, क्योंकि हमें हर वक्त हमारे जॉब से लीव लेके आना पड़ता है मैडम।
वर्षा,
और
मैं
हर वक्त वो भी हमारे बॉस बोल रहे कि अभी इतना लीव हम भी नहीं दे सकते, क्योंकि वहां पे भी सब इफेक्ट हो रहा है मैडम। तो इसलिए मैं आई, नहीं तो मैं आना भी नहीं चाहती थी, लेकिन स्नेहल भी परेशान हो गई और माँ भी परेशान हो गई मैडम।
वर्षा, ये तो मैं बिल्कुल समझ सकती हूँ, ये बहुत मुश्किल होता है परिवार लोगों के लिए छुट्टी लेकर आना, पूरा पूरा दिन लग जाता है यहाँ पर। देखो, मैं ये कोशिश कर सकती हूँ कि जब स्नेहल लेकर आए उनको, तो मैं उनको जल्दी से जल्दी चेकअप करवा दूं, या जो भी काम होना है, बजाय इसके कि 2-3-4 बार ये आए, एक विजिट में मैक्सिमम काम जो हो सकता है मैं वो कोशिश कर सकती हूँ, बिकॉज मैं आपकी तकलीफ समझती हूँ। लेकिन आना तो पड़ेगा, क्योंकि मशीनें यहाँ है, पूरा सेटअप है, इतना बड़ा हॉस्पिटल है हमारा, सारे स्पेशलिस्ट यहाँ बैठते हैं, तो ये सुविधा होगी कि आपको जगह जगह नहीं जाना पड़ेगा, एक ही हॉस्पिटल में आपका सारा काम हो जाएगा। कोशिश करेंगे कम से कम विजिट में मैं आपको बुलाऊं। मैं आपको अपना फोन नंबर भी दे दूंगी, अगर आपको कुछ चीज पूछनी है तो आने की जरूरत नहीं है, आप मुझे मैसेज कर सकते हैं, तो मैं आपको मैसेज में जवाब दे दूंगी, क्योंकि कई दफा मैं फोन नहीं उठा सकती, अगर मैं ओपीडी में हूँ या ऑपरेशन थिएटर में हूँ तो मैं फोन नहीं उठा पाऊंगी। आप मुझे व्हाट्सएप पे मैसेज करेंगे, मैं उसका जवाब आपको जब भी समय मिलेगा, जब
बस
जल्द
मैडम उनको विजन आनी चाहिए, इतना ही हमारी कोशिश है,
जितनी
क्योंकि हम भी बहुत परेशान हो गए मैडम, हम भी ऐसे नहीं करना चाहते। आपने बोला है, आपने अभी समझाया हमें, लेकिन हम सही में बहुत परेशान है मैडम। अब क्या
और
भी नहीं
मैडम
समझ
आगे
रहा,
का,
इसलिए हम
हाँ, और मैडम हम आगे का खर्चा नहीं कर पाएंगे। आप अभी आप जो हमने पैसा ऑलरेडी हॉस्पिटल को दिया है उसमें ही सब ठीक करके दो।
स्नेहल, देखो, ये जो टॉपिक है, जो आप पेमेंट की बात करें, इसका फैसला एक्चुअली मैं नहीं कर सकती, क्योंकि मैं यहाँ पर एक कंसल्टेंट की पोजीशन पर हूँ। फाइनेंशियल जो मैनेजमेंट है वो मेरे हाथ में नहीं होता, लेकिन मैं आपका केस डेफिनेटली अपनी जो मैनेजमेंट है उनको पुट अप कर सकती हूँ कि आपकी जो फाइनेंशियल कंडीशन है उसके बारे में मैं एक नोट डालकर दे सकती हूँ, और जो भी पॉसिबल हेल्प है हम कर सकते हैं, पर मैं इस तरह की कोई एश्योरेंस आपको नहीं दे पाऊंगी, क्योंकि ये मेरे बस में नहीं है। हाँ, आप आए, मैं आपको देख लूँ, तसल्ली से देख लूँ, मेरे कलीग्स आपको अच्छे से देख ले, ये मैं आपको अपने लेवल पर एश्योरेंस दे सकती हूँ। और जितना आप चाहते हैं कि उनकी विजन अच्छी आए, उतना ही मेरी हार्दिक इच्छा है कि मैं उनको अच्छी विजन देके भेज सकूँ, क्योंकि जितना आपके लिए ये बात चिंता वाली होती है, उतना ही डॉक्टर के लिए होती है, क्योंकि वो भी चाहते हैं कि पेशेंट को अच्छा रिजल्ट मिले। तो मैं अभी उनको
ठीक
एक
है
बार
मैडम, आप बोलिए अभी
मैं एक बारी देख लूं,
कब
फिर
आना
आपको
है। यस,
मुझे एक
बट
बारी
अभी आगे का खर्चा तो हम नहीं कर पाएंगे मैडम, बहुत मुश्किल है, सही में बहुत मुश्किल है। अगर हो सकता था तो हम, मैं और स्नेहल पक्का करते थे। हमने बहुत कोशिश भी किया है, यही मिलने के लिए बहुत कोशिश किया है, और हम दोनों भी सिंगल है तो बहुत मुश्किल जाता है मैम हमारे लिए। जॉब भी मैनेज करना, माँ को भी देखना, उनके कंप्लेंट से, बाकी डायबिटीज, हाइपरटेंशन, उसकी भी दवाई चालू है उनकी, उसके भी खर्चे हैं मैडम हमको। तो आप जरूर देखिएगा आपकी तरफ से।
मैंने जैसे आपको अभी बोला कि मैं आपका पूरा केस समझती हूँ, मैं एक नोट डालकर, जो हमारा जो फाइनेंशियल मैनेजमेंट देखते हैं, मैं उनको ये नोट डालकर आपका केस फॉरवर्ड कर दूंगी।
मैडम दूसरे आंख को ऑपरेशन करने के बाद भी वही होगा क्या उनका?
देखो, पूरी तरह से पहले चेक करा जाएगा, जो सिचुएशन होगी देखने के बाद तसल्ली से मैं आपको, जैसे इस केस में बताया वैसे ही दूसरी बारी में भी पूरा तसल्ली से बताऊंगी, और आप अपनी मर्जी से फैसला कर सकते हैं जो रहेगा। तो अभी एक बारी मुझे चेक कर लेने दीजिए, फिर मैं आपको इसके बारे में डिटेल में बताती हूँ। ठीक है?
ठीक है मैडम, स्नेहा लेके आएंगी उनको, आप बताइएगा,
थैंक यू
और
सो
कभी भी लगा तो मैं आपको कॉल करूंगी।
श्योर श्योर। थैंक यू। थैंक यू।
थैंक यू मैम।
थैंक यू।
कैन आई रिक्वेस्ट एवरीवन टू कम इन? So, what do you think I did effectively?
It was really, nice to see you doing that. It was a very good learning experience. So actually, the points, probably as you said, first recognizing the patient and relative, first thing, then building the rapport, then probably understanding ki yes, they are in the difficult situation, and we understand that. Second thing, we are ready to help them out, and giving them the this thing for second, maybe a taking opinion from other consultant or specialist. That clears their probably prejudice about us, that probably we are there to take advantage of them, and helping them on showing that willingness to helping them on financial part. So I think it completely probably it will help them, and they should calm down.
So do you think anywhere I appeared artificial?
No, ma'am.
Of course, this might appear very new to you because this is not the way we have been trained to handle situations. It may appear a little difficult to stay calm and listen to the patient and allow them to vent and then say what you want to say. But did I use any aggressive way to control them? Did I
No,
shout? Yeah.
No, they're very small things. I think we all probably are aware of it, but as you said, we are not trained, and probably we are not trained on that psychology part, handling human psychology. Probably we studied that in way back in MBBS. In our post-graduation days, it is never taught. It is not a part of our, probably it comes with experience, but it is never formally taught.
Whereas it should be part and parcel of the training of undergraduate and postgraduate program. Most of the patient handling is psychological. Clinical part, I'm sure you all do very well. But when you're not able to connect with your patient, win their confidence, understand their situation. Now put yourself in that patient's attendant position. If it was my mother, if it was my father, if I had spent 1 lakh rupee for this surgery, and even then he or she did not get the vision, how would I feel? Especially over and above that, the kind of stories we hear from all different sources. Immediate assumption is all doctors are cheat, just fool the patients. They do things for their advantage. They're just money-making machine. Nobody confirms. Nobody checks the truth. So we are actually working in a world of assumptions, probably wrong assumptions. As you said, prejudiced, stereotype thinking. So we have to be very safe and very careful in treading our way. The whole idea of this topic was, it's not that patient has to become violent and aggressive and break our things or hit us, that we have to do this. Lot of management is beforehand. If you are able to manage it well, you can prevent violence against you. You can send your patients very satisfied. I didn't give any false assurance to this patient's family. I never assured she'll get 6/6 vision. I never said second surgery will be perfect. I never said the financial part will be looked after. I did not, break down to the pressure that we will not pay. I didn't agree because that's not in my hands. But I said I will help. Whatever help is possible, I'll do. I can write a note. I can send this thing to the department who looks after the financial part. I can put a request on your behalf.
Ma'am, I have one query. Some patient may threaten you, like they may give some reference of some politician or some big localite. Okay. So in that case, what is your opinion? What you have to do?
आप बोलो, आप मुझे दो वो थ्रेट दो. दो.
वो जो MLA है ना मैम, वो तो हमारे बहुत अच्छे पहचान वाले हैं, दूर के रिश्तेदारी है. मैं उनको बोल दूंगा कि ऐसे ऐसे हुआ है, तो क्योंकि हमारी माँ को कुछ दिख ही नहीं रहा है मैम, और इतना पैसा खर्च किया है. वो तो हमारे बहुत दूर के अच्छे और अच्छे ये रिलेशन है हमारा तो रोज का आना जाना है उनसे.
स्नेहल, आप चाहें तो उनको बुला सकते हैं. मैं उनके साथ बात करने की तैयार हूँ, और मुझे वो जानते भी हैं, मुझसे पहले भी मिल चुके हुए हैं. उन्हें अच्छे से पता है कि मैं अपने काम बहुत तसल्ली से करती हूँ. पर अगर आप उनको बुलाना चाहें, बेशक ला सकते हैं, और मैं उनसे बात करने के लिए भी तैयार हूँ. मैं उनको समझाने के लिए भी तैयार हूँ कि आपके केस में क्या हुआ. बल्कि अगर आपके कोई डॉक्टर जानकार हैं जिनको आप जानती हैं और जिन पर आपको विश्वास है, आप चाहे तो मेरी उनसे भी बात करवा सकते हैं. मैं उनको भी एक्सप्लेन करने के लिए तैयार हूँ कि आपके पेशेंट के केस में क्या हुआ. क्योंकि मुझे मालूम है कि मैंने आपके केस में कोई गलती नहीं करी है, पर अनफॉर्चुनेटली उनकी अगर आँख के अंदर कमी है या आँख की संरचना में कोई कमी है, या जैसे आपने बताया उनको डायबिटीज भी है, ब्लड प्रेशर भी है, उसकी वजह से जो आँख के अंदर नुकसान हुआ होता है, उसकी वजह से कई बार विजन नहीं आती है. ये सब चीजें मैं उनको बहुत अच्छे से समझा सकती हूँ. आप चाहें तो उनको बुला सकते हैं, मुझे कोई दिक्कत नहीं. When you say this, they are not going to call, but that desire to quote their name is satisfied. अगर मैं ये ऐसे जवाब दूं, बुला लो, जिसको मर्जी बुला लो, क्या फर्क पड़ता है, उनके बुलाने से क्या हो जाएगा. I am confronting, I am aggressive. To align the person with me, I have to align with the person. I don't have to disagree for unnecessary reason. I have to agree first. आप बुला लो, और मुझे जानते हैं, मुझसे पहले भी 1-2 बारी मिल चुके हुए हैं, उन्हें पता है कि मैं अपना काम बहुत तसल्ली से करती हूँ. So that means I am already informing the patient. I know them, he knows me. I do my job well, and he knows I'm very responsible doctor. And it's always good to have good rapport with your local leaders. Please don't hesitate making good rapport. When I say good rapport, I'm not asking you to be friendly with them, but respectful, cordial. That helps sometimes, when you have people around you who are there to support you, a lot of problems can be prevented just by having them in the picture.
Ma'am, I have one query.
Sure.
This was a situation where the surgeon was not at fault. But sometimes there is a situation that the surgeon is at the fault, and we have to implant some other lace. We have promised for one lace, and we have put some other lace because it's the surgeon fault somehow. And the patient has gone outside, and from other surgeon, they have confirmed that that was a surgeon fault. And so the patient has become violent. So how to handle that situation?
Although this topic I'm going to cover in the last session, that is disclosure of medical error or complication. If you call this as a medical error, I would not even call it medical error, because you took on the spot decision considering patient's welfare, and you decided to put another lens. That's not an error, that's a decision, and that's your discretion. That's doctor's discretion, and we all know that. But I can immediately give you some thoughts so that you go satisfied with this question. Instead, the patient going and getting himself or herself checked by another doctor and confirming that the patient was not put the same lens, it's my responsibility to, after surgery, call the patient's family and inform them as early as possible. So normally after surgery, we call the family and tell surgery went well, everything is fine. Hopefully patient will be able to see it was a very smooth surgery, or whatever your, way of explaining to the family. But if you put another lens, you may have to even tell. आपके पेशेंट के केस में जब हम ऑपरेशन कर रहे थे, तो जो लेंस हमने डिसाइड करा था कि डालेंगे, लेकिन जो सिचुएशन देखने के बाद हमें लगा कि वो लेंस इनको सूट नहीं करेगा, और इस वजह से ये हमें उसी वक्त डिसीजन लेनी होती है, और हमने ली कि इस लेंस की बजाय ये वाला लेंस डाला जाएगा. ये भी लेंस उतना ही अच्छा है, लेकिन ये लेंस हमारे पेशेंट के लिए ज्यादा यूजफुल है. जब भी आप वर्ड यूज करेंगे ना, हमारा पेशेंट, दे विल फील दैट यू आर देयर पार्टी. ये आपके पेशेंट के लिए अच्छा है. यू आर क्रिएटिंग 2 पार्टीज. कि टेबल पर ही मैंने डिसाइड करा कि हमारे पेशेंट के लिए ये वाला लेंस बहुत अच्छा है, तो मैंने ये वाला लेंस डाला है. पर अब मुझे पूरी उम्मीद है कि पेशेंट को इससे फायदा हो. अब क्या कुछ जब देखो, जब हम छुपाते हैं ना, कई बार हमारा स्टाफ जाके बता देता है, क्लीनिंग स्टाफ बता देता है, हमारी टीम के कुछ लोग जो हमारे अगेंस्ट होते हैं वो जाके बता देते हैं. सो ये पेशेंट को लगता है कि आपने चीटिंग करा है. अगर आपने ऑनेस्टली एडमिट करा कि ये हुआ और ये मैंने करा, और मैं इसकी जिम्मेदारी ले रही हूँ, क्योंकि मैं आगे जो एक सेशन होने वाला है वो पूरा प्रोटोकॉल डिस्कस करूंगी आपके साथ में. डिस्क्लोजर ऑफ मेडिकल एरर, ब्रेकिंग बैड न्यूज, ये अभी 2 टॉपिक्स हमारे बहुत इंपॉर्टेंट है जो हम डिस्कस करेंगे. बट जस्ट टू टेल यू, रेदर देन पेशेंट गेटिंग टू नो फ्रॉम समबडी एल्स, तब यू विल बी कंसीडर्ड कि आपने झूठ बोला और आपने छुपाया है.
One more situation, ma'am. If the patient becomes aggressive and starts beating us, still we have to keep our calm?
No. ये अभी जो टॉपिक डिस्कस करने जा रहे हो, जो मैं प्रेजेंटेशन आपके साथ अभी डिस्कस करूंगी, उसमें डिफरेंट स्टेजेस है, बड़ी डिस्टिंक्ट स्टेजेस हैं क्राइसिस डेवलपमेंट की. जब फिजिकल हार्म आपको दिख रहा है तो उसका मैनेजमेंट बिल्कुल अलग था, लेकिन स्टेज 1 और स्टेज 2 को इग्नोर नहीं करना है. अगर आपने इन 2 स्टेजेस को मैनेज कर लिया, यू कैन मिटिगेट ऑलमोस्ट ऑल सिचुएशंस. 3rd और 4th आने से पहले मैं अभी ये डिस्कस करने वाली हूँ आपके साथ. अगर पेशेंट एग्रेसिव हो गया और पेशेंट बिल्कुल वायलेंट हो गया, देन इट इज समथिंग लाइक यू आर हैंडलिंग अ साइकियाट्रिक पेशेंट. स्किज़ोफ्रेनिक पेशेंट अगर एग्रेसिव हो जाते हैं तो क्या आप उसको एक्सप्लेन करेंगे? वहां पर आप सिर्फ सेफ्टी देखेंगे, पेशेंट की सेफ्टी, अपनी सेफ्टी. और इस केस में तो हम पेशेंट को उसकी फैमिली मेंबर को पकड़ भी नहीं सकते हैं, बिकॉज अगेन वी विल बी गोइंग अगेंस्ट द लॉ. अगर हम उसको 10 लोगों ने मिलकर पकड़ लिया कंट्रोल करने के लिए, then it is best to move away from that situation. then your safety and your staff safety is primary in that situation. Any other question? Then we discuss the presentation, if it is okay. Okay, let me share the screen with you and share the presentation. I hope the first slide is visible to all of you.
Yes, ma'am.
Yeah, it's visible.
Sure. Okay. So this is the carry home message that I want all of you to go with, because, and I've shown this as a first slide, because this is where the action, is in your control. One, identify patients who are likely to be aggressive. So I was talking to my daughter, who is a dentist who's practicing in US. I was just discussing about this, topic, aggressive patients. So she said, in our setup, we do disc analysis of all the patients who come to our clinic. I said, DISC is actually a personality testing tool. I said, that's such a lengthy tool. So how do you implement it with patient? She said, no, we don't formally introduce any test or tool, but the first person who comes in contact with the patient does some observations and asks some questions. And then in a very cold word, they write the type of personality. Is this person likely to become aggressive or very dominating or very demanding, whatever. So similarly, I think one thing that we all have to mentally, be observant about is triaging the patient. I'm sure all of you are familiar with the term medical triaging. I want to introduce the term social triaging. So identify the patients who are likely to become aggressive, patients who are educated, patients who are paying well, patients who are coming from a bureaucratic background or political background, or their body language also sometimes tell, or somebody who has a lot of sons and children coming to the hospital with them. That means that person or that family can become aggressive. And also I want to tell her that it never storms before. It always storms before it rains. It suddenly doesn't start raining. You can actually sense, it's going to rain today. So that means it's an indication that these are warning signs. There's a possibility of an argument or the person becoming aggressive. And that's the best opportunity to intervene before the crisis occurs. After that, it's something that you will have to just mitigate and do the crisis management, but it should be done as early as possible. And then we need to learn to handle these situations very carefully. Any lapse at any point can be very, very expensive, can be very damaging. So before we go further, I think it will be helpful for us to understand, why do people become angry? Why do patients get angry? Any idea? Any idea? Why do patients get angry?
Feeling of being neglected.
Yes, feeling of being neglected. If they're not attended properly or promptly, they feel we don't exist, we don't have any value. True. Any other reason?
They think the wrong treatment has been given.
That means they are victim of some injustice.
Injustice, yeah.
Absolutely.
Not met with their expectations.
When their expectations are not met, they have a feeling that they have either been given an unfair treatment, or there is some injustice done to them. Agreed. So if I go by the explanation Park Gorkin gives, he says there are 4 phases of anger, and they start from 4 eyes. So whenever one has a palpable sense of injustice, injury, invasion, and intention, there's a possibility of aggressive reaction. Let's understand each term briefly in the healthcare context. For example, whenever a patient will have this feeling that I'm a victim of injustice, unfair, or disloyalty, they will become angry. So whenever they feel I've been given unfair treatment, or the doctor or the healthcare providers have not been just to me, or there is something wrong done by somebody to me, there is a feeling of anger. The second I is about injury, where the person often feels, actually it is psychological, often feels that I am disrespected, discarded, or ignored. Whenever you will kind of not listen to them or not answer their questions or explain to whatever they want to understand, or sometimes we even ignore their presence around us. We don't look at them. We deliberately avoid making eye contact. So all that is adding to the injury. And there's a sense of insult and humiliation. As a result, there is anger in the person. The third reason for anger is invasion, where the person feels his or her personal space is constricted, disrupted, or violated. So sometimes when we, all of us pound over the patient and start examining the patient, especially if it's a rare condition, and you examine the patient under slit lamp, and then you let your fellows examine the same patient, and then somebody else starts examining the patient, when they feel, am I a guinea pig? So sometimes that can add to their feeling of invasion. Even in places where we say, okay, you don't have to go to toilet, use your bedpan. So some people feel very uncomfortable using bedpan. They want to go to the toilet because they feel they have been constricted, their autonomy is affected. So whenever there's a feeling that their identity or integrity is being threatened or attacked, there's a possibility of invasion. So when any of these three or all of these three happen, there's the energy and determination to do something about it. Patient is ready either reflexively or purposefully to challenge the status quo. So some will quietly accept it, but there are people who would not take it easily. They will not accept it, and they are likely to become aggressive and react to it. As I said earlier also, there are 4 stages of crisis development. Actually, you will be able to see these 4 stages distinctly from now onwards when you will try to handle these situations across the hospital. And if one can, intervene at stage 1 or 2, you can actually control the situation. As I mentioned earlier also, crises do not happen suddenly. There are always warning signs. There are always red flags. And that's called an opportunity to intervene and control the situation. And due to the nature of this situation, I think we all need to learn to be calm and vigilant and manage proactively. If we are not vigilant, you may miss the warning signs and end up into a crisis situation. So by observing some of the following steps that I'm going to discuss with you, you can mitigate the situation at an early stage. So crisis stage 1 is called anxiety stage, where you can actually see observable and unusual changes or increase in the behavior. So what exactly it will be? You will see them speak in a louder than normal voice. They will not be talking in a normal. It could be with your nurse, it could be with your optometrist, it could be with any of the attendants in the hospital, but you will see that there'll be little raised voice. They'll be pacing up and down. They'll try to talk to different people, asking their doubts or asking questions. They will express doubt either with you or with your staff. They may ask a lot of questions to you or to your staff. So that's an indication that there is some anxiety mounting up. Handling this situation right in the beginning can help you control the situation. So don't ignore this. Please pay attention and segregate them from the crowd. For example, if you're moving the corridor and if you see any patient arguing with the security staff, don't assume that security guard will manage it. Stop for a second, ask what is it? Because the moment you will intervene, you'll be able to control the situation right then and there itself. Suppose if it is happening within your department in front of you, immediately I think the best thing is to segregate them from the crowd. Give them a safe place, take them to a side room, make them sit, offer them a glass of water, and ask them what is the issue. So, and when you do this, it's important to identify yourself and your role. It's very important to tell, okay, I'm the consultant here, or I'm Dr. So-and-so. I'm ready to help you. Tell me what is it about you. Explain the process and procedure in simple terms. Okay, tell me what is it that you want to address. Acknowledge their emotional pain, feeling, or help. When you saw, I identified Varsha and Snehal. Varsha, I did not know. Snehal, I knew. I immediately identified Snehal. She knew that I'm the one who operated her mother. Then I acknowledged the emotional feeling and I allowed them to talk. I heard them. I did not try to interrupt them. I just heard them. I acknowledged their plight. That yes, I understand. You have to come and wait for the whole day. So empathize with them and anticipate what all questions they can ask you, and then you need to be ready with explanation and answer. Now, for example, financial management, I knew I can't intervene. Political interference, I knew I cannot, but I need to be ready with how I'm going to handle. So some questions that are likely to come your way, have an answer to them, you will be able to manage them well. Now, once you have told them, okay, I'm there to help you, ask them what is it that's their bone of contention or what is bothering them. So when they are even when you observe their body language, the way they are talking, all that will give you an idea what exactly is their concern. And when they are sharing their concern, listen attentively. Half the suffering diffuses when somebody listens attentively. Even this case that we did the role play, now there is no vision improvement as expected. That's a very true situation. And maybe I cannot turn the situation overnight. But just listening to their concern will give them the satisfaction. Okay, I'm understanding their point of view. They are the only daughters. They are the only earning members. Their mother is living alone. They are earning very little. They have spent their lifetime saving for their mother's surgery. So these are very genuine concerns. And if you just give them 2, 3, 5 minutes to vent, I think half the suffering gets diffused. If need be, you can clarify the message. If you think that you have not been able to understand, you can actually ask question and check what exactly they want to say. Try to see the feelings behind the facts. Usually we look at the behavior and we don't understand the feeling behind that. So if you will let them, express what exactly is their feeling, you will get to understand. So for example, I am reminded of one case where one lady who had come from a different place, from a far off place, she had come to the city visiting her father who was admitted in the ICU and who was in a critical condition. She was informed by her mother that he's really unwell and so you need to really come and see as early as possible. So she flies and she goes to meet her father, and then she goes to the ICU, and the ICU guard, normally like we have that protocol that you're not allowed to visit ICU beyond visiting hours. So ICU guard very bluntly said, visiting hours nahi hai, so come in the visiting hours. So she requests the guard to check with the nurse if she can be allowed to see the patient because she has come from a far off place. So even the nurse unfortunately did not go into the details that who is the attendant who wants to see and why now out of visiting hours she wants to come and see. So she also refused this. She says, no, let her come after the visiting hours. Now this lady becomes aggressive because she has come from a far off place. She had received this message from her mother that father is really unwell and she's really wanting to see her father. The moment you will talk to the lady, you will get to realize that there's a fear that the father might die. Maybe these are the last few minutes that she can see her father alive. So sometimes when you listen and you try to understand the background, you get to realize the feelings, the fear behind the facts. If need be, you can ask a reflective question and clarify what exactly. So maybe if the nurse or the security guard, instead of just saying no, you cannot visit the ICU of the visiting hours, he could ask, sir, ma'am, आप visiting hours में आइए तो आप अभी इस वक्त नहीं मिल सकते. And then if the lady says, भैया मैं अभी बाहर से आई हूँ, अभी मैं आई हूँ, मैंने पापा को नहीं देखा, मुझे देखना है, मुझे सिर्फ 2 मिनट, तो अगर उसके साथ 10 लोग खड़े हैं, आप पूछ सकते हैं कि सभी लोग जाएंगे क्या अंदर? तो she says, नहीं सिर्फ मुझे 1 मिनट देखने दीजिए. Maybe you will accommodate. So a lot of time, understanding the message also helps to handle the situation. So when they're sharing their concerns, please be mindful of your body language. It's very important to remember that our demeanor, if that communicates something different and what you're saying is different, it is incongruency that confuses the patient. So if you look at the picture, this person has an expression of not agreeing, of actually sarcasm. So we really need to be mindful of our demeanor. Also, when the person is speaking, don't interrupt. Let them complete. So if you observe, Varsha and Snehal were doing most of the talking. I didn't interrupt them. I allowed them to speak. And if you will revisit this video, I think you will see this was just for maybe 2-3 minutes, but that really helped them to calm down. So if you don't interrupt them and let them complete, usually they calm down after speaking. Even if they are saying something incorrect. आपने कहा था कि सर्जरी ठीक होगी, आपने कहा था विजन अच्छा आ जाएगा. कब कहा था मैंने आपको? मैंने आपको बताया था कि सर्जरी में ये रिस्क है. आप गलत बोल रही हैं. आपके सामने मैंने आपको ये देखो आपने साइन करा हुआ है इसके ऊपर. If I'm trying to do that again, that's going to break down the communication. I allow them to speak and then I say कि मैंने स्नेहल को पूरा एक्सप्लेन करा था कि इस वक्त क्योंकि मोतियाबिंद है उसके पीछे हम देख नहीं सकते हैं, इसलिए उम्मीद कर चलते हैं कि पीछे सब ठीक होगा और ये लेंस से इनको फायदा. So even if you have to correct, you don't have to correct immediately. There is no point in justifying yourself. आप क्या समझते हैं मैंने जानबूझकर ऐसा करा है? So that's going to add to the fuel to this fire. And don't shun away their concern. If they say कि हम रोज नहीं आ सकते, हम छुट्टी करके आ रहे हैं, स्नेहल को छुट्टी करके आनी पड़ती है, हम प्राइवेट नौकरी में हैं, हमें छुट्टी नहीं मिलती है, भैया ये अब आपका कंसर्न है. आपको पेशेंट को दिखाने आने आपको आना पड़ेगा, मैं आपके घर आऊंगी क्या? So we have to be very careful of what we say and what we don't say. Again, please practice empathy because it's important to put yourself in their shoe. Immediately सोच के देखो अगर ये मेरे घर का कोई होता तो मैं कैसे क्या महसूस करती as a patient or patient attendant. I think we are able to immediately calm down the moment you will put yourself in that position. So please don't discount their feelings or don't judge them for their feeling. Whether or not you think these feelings are justified, those feelings are real for them. So it's important to acknowledge them rather than being critical of their emotions. It's important to acknowledge, normalize, and generalize. This is the way you express empathy. So when you say, I can see it's very difficult for you to come, I understand you spend almost whole day when you come to a hospital and it's quite tiring for anyone. So what you're doing, you're acknowledging, I understand it must be very tiring for you. You're normalizing. Yes, I think anybody who would come to hospital would almost spend the whole day. Generalize. Anybody would feel the same way the way you're feeling. So when you use these ways of calming the person, they feel that, okay, there is somebody who understands their plight. A lot of time you can't change the reality, but when you say, yes, I see the reality is very painful for you, it helps. Apologize. How many of you agree with this? And why do we need to apologize? What do you say?
We can apologize. Hello. Yeah, we can apologize for the inconvenience, but not apologize for the whatever surgery or whatever we have done.
Wonderful. Excellent. See, we normally hesitate apologizing. So apologizing for the inconvenience is helpful in calming the person. In case if error has happened, you operated the wrong eye, then I have to apologize even. I have to take the responsibility. If we deny taking the responsibility and we say, galti hua hi nahi hai, aapko galti lag rahi hai, galti hua hi nahi hai, they are no fools. They have also seen world. They can make out that we are just trying to fool them or cover. So in those situations, and I have very beautiful videos that I will be sharing with you when we talk about disclosure of medical error, you will see how apologizing actually calms down the person. They get to see that you haven't done it willfully. It has happened, unfortunately, but you haven't done it willfully. And that's where they feel, They start to calm down. So apologizing for the inconvenience, very true. As I said, there are two meanings of apologizing. One is expression of compassion, and the second is expression of responsibility. So expression of responsibility only when you know that, yes, some error has happened from your side. You will have to, whether you like or not, trust me, apologizing does help in such situation also. In certain situations, apology fail when you say something like this. If what you're saying is true, then I think I would apologize. Or there was a mistake, but then something like this can happen. So actually, this is not going to sound like an apology. I'm sorry, we can't attend to individual requests. Again, that will not work. I'm sorry, we don't allow visitors during non-visiting hours. Again, this apology is not an apology. Sometimes these things happen, but you have to take it. So all these ways of apologizing are actually not a wonderful ways, and they are unhelpful. This is another way which you can use in handling the situation. Try reverse empathy. What I mean by reverse empathy is when you help them see your perspective. आप बताइए उस situation में, I thought this was the best thing to be done, and I did my best. I hope you can see my point of view. So what you are trying to help them see your perspective. Okay, explore alternatives. I think once you are talking to the patient or the family and trying to see what is their concern, and you're trying to find what exactly does the patient want. For example, in this case, if the patient wanted money from me, and I know I cannot return the money, I would not like to do that because you don't want to set a wrong trend. So it's important to check what does the patient want. Usually more than money, they want attention, care, prompt attention. Sincerely try to resolve the issue and address the concern. Focus on the solution rather than the behavior. Even if they are aggressive, try to go deep down into what exactly they want. Ignore the behavior, look at what exactly they want. And avoid being defensive, because if you become defensive, then you are likely to become aggressive later on, and also it will ensue into an argument with them. So when it comes to exploring alternatives, you have to really go sometimes, you have to think more creatively to find what will work. So draw these 9 dots if you have a notebook with you. Do you have a notebook with you? Draw these 9 dots. Connect these 9 dots with 4 straight lines without lifting your pen. Should I repeat?
Yes, ma'am, please repeat.
Draw these 9 dots. Connect these 9 dots with 4 straight lines without lifting your pen. And if you have done it, you have done?
No, madam, it's not possible.
It's not possible.
Is it?
Possible.
2 dots are remaining.
Not possible, ma'am.
Not possible?
Not possible. Dots will remain.
2 dots will remain.
2 dots will remain.
Yes, yes.
Try little more if you want. Take another 30 seconds.
One dot remain, ma'am.
1 dot. So from 2, we have come to 1 dot. Try if you can connect all dots. Our beliefs are the greatest hurdle in our creative thinking. When we say to our body and mind that it is not possible, actually it's not possible. But when you keep this program to your mind that it is possible.
Yes, ma'am, it's possible.
It's possible.
I have connected.
Let's see.
Yes.
Show against the camera. So how many lines are there?
Like these.
No, there are more than 4 lines.
No, this is more than
four
4.
straight
Four
lines.
lines. Okay.
Only 4
4
lines.
only.
Only with 4
Okay.
lines.
I'm very
Varsha,
happy
is
you
there?
tried. I'm very
Ma'am?
happy you tried. Yes, please. How many
I-
lines are there? 8.
1, 2, 3, and 4.
Without lifting up the pen.
Without lifting your pen.
Without lifting the pen. Yeah.
So do you want to see how we can do
We'll
that?
try, ma'am, once.
Oh,
Okay.
The idea is that you have to go out of the box to think for some creative solutions. And if I tell you that connect these dots with 3 lines, is that possible? This is another example of 4 lines. And this is an example of 3 lines. The whole idea of this exercise is to learn to go out of the box. So when people say you cannot run programs online, initially even I had this thought, no, it's not possible to run any program online. But when COVID-19 came, we all became pro at using Zoom. We were not in favor of telemedicine. No, telemedicine is the way of life. We are not open to using AI. We think AI is my enemy. How many of you have used ChatGPT? Have you tried ChatGPT? See, these are our blocks. These are our blocks. Last week, my daughter, not last week, 2-3 days ago, this weekend, my daughter called me from India. She said, Mom, ChatGPT use kara hai. She's my, true trainer, you can say. Ma'am, Mama, ChatGPT use kara hai. Maine kaha nahi. Keh rahi hai, laptop kholo. Abhi kholo. She was on phone with me. Okay. Go to this website. Maine website kiya. Sign in karo. Maine sign in kara. She said, now put any question. I just wrote stress management for doctors. Trust me, the points it gave was mind blowing. So आज चैट जीपीटी डाउनलोड करिएगा अपने फोन के ऊपर और एक क्वेश्चन डालिएगा कुछ भी, हाउ टू मैनेज एग्रेसिव पेशेंट्स और हाउ टू मैनेज पुअर परफॉर्मेंस और हाउ टू मैनेज differences between people, and it gives such beautiful points that you don't have to. So technology is not our enemy. We are not comfortable with technology because we are not used to it. So explore alternatives. Ask, what do my patient want? See what can you do. Maybe you cannot offer 100% of it. She said, I can't pay anything. I said, I can't assure you this because that's not my decision. But I can definitely forward your case. That gave her satisfaction. I said, I can do this, that when you come in one visit, we do maximum whatever we can do so that you don't have to come, for number of visits. So you have to think, what more can I do that can compensate the patient and send my patient happy? The thought process has to be problem solving. That's the whole idea. So that was stage 1, where you could see anxiety, you could see patient angry, patient is asking for help. If everybody refuses, if the security guard says no, if the nurse says no, and if the resident says no, this patient's family member is going to be very unhappy with you. that you were not letting me go in to see my father. If unfortunately the father died in between, before the visiting hours, forget about the reaction the patient's family will have. Just look at it. There was an opportunity when the patient's attendant could see the patient alive, and we did not allow, just because the patient is in ICU. What would have gone wrong if I had said कि मैम और कोई नहीं जाएगा, क्योंकि आप बाहर से आई हैं, आप जा सकती हैं, आपको प्रॉपर ये गाउन पहनना है, कुछ भी टच नहीं करना है, अंदर बात नहीं कर पाएंगे आप, आईसीयू है, बाकी पेशेंट डिस्टर्ब होंगे, सिर्फ 2 मिनट आप देख कर आ जाइए, आई अंडरस्टैंड, क्योंकि आप बहुत दूर से आई हैं एंड यू आर वेरी ईगर टू सी योर फादर. आप चुपचाप जाके 2 मिनट देख कर आ जाओ. टेल मी व्हाट वुड हैव हैपेंड, which sky would have fallen down. I had gone for assessment of a very premier hospital. I'm an assessor with NHSRC. हम पेशेंट्स के अटेंडेंट को गाउन पहनने के लिए कहते हैं, चप्पल नहीं अंदर ला सकते, मास्क लगानी है आपको, ये करना है, वो करना है. पूरा हॉस्पिटल आईसीयू स्टाफ जो था वही चप्पल अंदर बाहर पहन के जा रहा था, मास्क लगाया हुआ था, यहाँ पे लगाया हुआ था, जो ग्लव्स पहने हुए थे उसी से पेशेंट को टच कर रहे थे, उसी से नॉन स्टेराइल चीजों को भी टच कर रहे थे. डू वी फॉलो द प्रोटोकॉल जो हम उनको सुनाते हैं? The whole idea is that we need to really open our mind. Attend at this stage, chances are the patient will go into the second stage, and that is called defensive stage. The first stage was anxiety, second is defensive. In defensive stage, as the picture says, emotions take over the logical mind. You will see this patient becoming aggressive, unhappy, frustrated, irritated. Rationality would be losing its ground. Loud voice, aggressive body language, and you will see this person actually start challenging you and your authority. They may also become belligerent. They may talk illogical things and start blaming you. आप लोग चोर हैं, आप गलत हैं, आप धोखा करते हैं, आप ये कर. That's because now they are losing control with what is truth and what is not. You will see them speaking in a loud voice, arguing with your security staff, technicians, nursing staff. Expression of dissatisfaction, expression of disagreement, refusal to cooperate, refusal to pay. Now, again, this is one stage where you can intervene. If you did not come in this situation in stage 1, you are in stage 2. You can see the patient is losing control, becoming aggressive, is violent. Again, you can intervene at this stage and control. For example, the first step that you can take is provide them guidance by asking them to calm down. आप थोड़ा आराम से बात करें, आप मेरे से बैठ कर बात करें, मैं आपकी बात सुनने के लिए तैयार हूँ, जो भी आप चाहते हैं मैं हेल्प करने के लिए तैयार हूँ, लेकिन आपको पहले थोड़ा शांत होना पड़ेगा ताकि मुझे समझ तो आए कि आप क्या चाहते हैं. That is, you are providing them guidance. Then you are giving them direction. For example, if they are not happy with you, they are not satisfied with your way. नहीं, मैं पैसे दूंगा ही नहीं, मैं पैसे कर दे. अगर आप कहते हैं कि मैं, this is not my prerogative, I cannot decide on this, but I can refer you to the person who can help you this. So maybe they can go to the right person and talk, or maybe they can write even in complaint. आप अगर dissatisfied है, आप complaint लिख दीजिए, हमारे यहाँ कमेटी है बकायदा, वो बैठकर इसको देखेगी और जो भी possible help करेगी. If you want to give feedback, give. So what you are doing, you are asking them to express their anger in the right way. Then if you are still working with them and you are trying to find a way, take control of the situation, but with a problem solving mindset. That's very important. Assert. Yes, please.
Want to ask one question?
Yeah, please.
But if someone is running their own hospital, private practice, then you can't refer to the here in institute we can tell patient that it's not means I'm working here as an employee, so I'll refer you to the specific person for the financial issues. But what if we are running a private hospital?
That means you are the one who is going to handle all questions and all requests they make. So if they say that we want a financial compensation, again you have to pick your battles. One, if you really know that this person is capable of damaging me, then you really need to pick the battle, whether you want to go into the battle with the patient or you want to just end it here by just compensating or by by giving some discounts or by giving some facility. But usually if you're good, if your overall conduct is good, patient would not ask you for money. They would want cooperation in terms of follow-up and also whatever best can be done. But in case if they are asking for, if they are trying to exploit or extort money from you, there you can put your foot down and say, for example, if somebody says कि मुझे पूरा पैसा वापस चाहिए, अगर आप चाहते हैं कि मैं पुलिस में नहीं जाऊं और आप चाहते हैं कि मैं मीडिया को नहीं बुलाऊं और अगर आप चाहते हैं कि मैं पुलिस नहीं बुलाऊं तो मुझे मेरा पूरा पैसा वापस चाहिए। देखिए, मेरे हिसाब से मैंने सर्जरी में कोई गलती नहीं करी है। मैंने अपनी तरफ से जो बेस्ट पेशेंट के लिए होना चाहिए था वो करा है। जो भी ट्रीटमेंट प्रोटोकॉल है मैंने वो फॉलो करा है। आप जाना चाहते हैं पुलिस में जा सकते हैं, मैं मना नहीं करूंगी आपको, आप जा सकते हैं। लेकिन और अगर कोर्ट में आप जाएंगे, मैं अपने सारे डॉक्यूमेंट्स वहां प्रोड्यूस करूंगी। ठीक है, उसमें आपका भी टाइम खराब होगा, मेरा भी टाइम खराब होगा, लेकिन मुझे वो नहीं है, क्योंकि मैंने कोई गलती नहीं करी है। यूजुअली व्हेन दे आर फाइटिंग विद यू, उनमें से 1-2 लोग ऐसे होंगे जो आपके साथ अलाइन कर रहे होंगे, जो आपकी बात समझ रहे होंगे। टेक एडवांटेज ऑफ दैट। देखिए, सर्जरी हुई है, आपको पता है खर्चा हुआ है, इलाज हुआ है। अब अगर आप मुझे कहें कि मुझे पैसे वापस कर दीजिए, जो काम किया गया क्या वो वापस हो सकता है? ऐसा नहीं हो सकता। लेकिन मैं ये कर सकती हूँ कि जो आगे ट्रीटमेंट होनी है, अगेन यू कांट टेक द रिस्पांसिबिलिटी ऑफ ट्रीटमेंट एक्सपेंडिचर। अगर उसको रेटिनल डिटैचमेंट हो गया है और उसके लिए ट्रीट करना है, ठीक है, अगर आप चाहेंगे मैं आपको सरकारी हॉस्पिटल भेज सकती हूँ जहाँ पर आपका मिनिमम खर्चे पर इलाज हो जाएगा। यहाँ पर भी अगर आप मेरे पास इलाज करवाते हैं, जो जरूरी खर्चा है वो आपको करना पड़ेगा, ठीक है। जो मैं डिस्काउंट कर सकती हूँ मैं छोड़ दूंगी, मैं मना नहीं करती। सो व्हाट यू आर डूइंग, यू आर नेगोशिएटिंग, बट यू आर नॉट बोइंग डाउन टू द प्रेशर। अगर जहां आप डिफेंस में चले गए, वहां यू आर आउट। तो वहां पर आपको यू हैव टू, और वो ये तभी हो पाएगा अगर आप एग्रेसिव होंगे ना। तो एग्रेशन में आप कहेंगे जो करना है कर लो, आई डोंट केयर, जा चला जाओ पुलिस में। तुम्हारे पुलिस में जाने से क्या आंख आ जाएगी क्या वापस, रोशनी वापस आ जाएगी? सो यू विल नॉट बी इवन एबल टू थिंक कि मुझे उसमें क्या हैंडल करना। तो यू हैव टू स्टे काम टू हैंडल दिस। सो क्लियरली स्पेल आउट व्हाट यू कैन डू एंड व्हाट दे शुड डू। आप क्या कर सकते हो, क्या करने के लिए रेडी हो और उन्हें क्या करना है ना। सेट बाउंड्रीज, टेल देम क्लियरली दैट एग्रेसिव बिहेवियर इज अनएक्सेप्टेबल, दे कांट एक्ट एग्रेसिव एंड गेट व्हाट दे वांट। देखिए, आपको आराम से बात करनी पड़ेगी। मैं आपकी बात सुनने के लिए तैयार हूँ, लेकिन अगर आप चिल्ला कर बोलेंगे मैं नहीं सुन पाऊंगी, मुझे समझ ही नहीं आएगा आप क्या बोल रहे हैं। आप शांति से बात करेंगे, मैं सुनने के लिए तैयार हूँ। मैं कोशिश भी करूंगी कि जो आपकी हेल्प कर सकती हूँ मैं जरूर करूँ। सो बी फर्म बट नॉट एग्रेसिव इन योर अप्रोच। Very important is to be aware of your body position and body language. See, please remember, if you are standing eye to eye and toe to toe, it sends a message that you are challenging them. Again, it's very unsafe. हो सकता है आप ना करें, आपका सिक्योरिटी गार्ड ऐसा करे या आपका कोई टेक्नीशियन ऐसे बात करे उसके साथ में। Don't encourage that kind of behavior from your staff also, because the moment you will invade their personal space, they will feel anxious and they'll feel that you're going to hit them. So in fear, they might hit you or your staff. So maintain that safe distance. So the best way will be to maintain a 3 feet distance from the person. That's one thing. Preferably have a table between you and the patient or the person with whom you're having a discussion. So अगर टेबल है और टेबल की एक तरफ आप है और टेबल की दूसरी तरफ वो है, I think you can handle that situation very well. I also recommend 2-door policy. Counseling room should have 2 doors. One for you to exit, one for the patient family to enter and exit. In case of aggressive behavior, when the patient or the family becomes violent, if you don't have an exit door, where will you go? You will go towards the door. You're going closer to them. You are more likely to be hit by them. So have 2 doors where you can, when you can sense there's a risk to my safety, you say, just a minute, let me call somebody for help, or let me ask my seniors to come and talk to you. You just move out. You can ensure your safety. So the videos that we see of violence against doctors, usually it is happening in the OPD or in the ICU or in the emergency department. It's in open and all of them come as a mob. If we were attending them, in a counseling room, talking to them, having a table in between, having 2 doors, A lot of situations can be prevented where the residents are unfortunately, beaten up by the patient's family. So make sure at this moment the patient is in, getting aggressive. Don't argue. Don't answer for the sake of answering. Don't speak for the sake of speaking. You don't have to answer every question. Some of the questions will actually be just to provoke you. आप सबके साथ ऐसे ही करते हैं क्या? सब पेशेंट्स को आप ऐसे ही पागल बनाते हैं क्या? So these are questions. They are just out to provoke you. Avoid answering them. Instead, redirect their attention to the problem. देखो मैं जो पॉसिबल है वो कर सकती हूँ, आप ये कह रही हैं ये मेरे लिए पॉसिबल नहीं. So bring their attention to the point. And answering challenging questions will be more like, power struggle kind of a thing. Allowing them to vent is a very good idea, to let them speak what they want to say. You get an idea what is on their mind, what is their concern. And if you think you can't allow them, for example, if it is ICU, OT, labor room, emergency, if you can't allow them, it's always good to tell them कि देखिए यहाँ पर आप शोर नहीं मचा सकते, आप मेरे साथ बाहर आके बात करें या आप मेरे साथ वाले रूम में बैठकर बात करते हैं. But you can't allow them to vent. But usually allowing them to vent helps. Again, set limits where you actually, offer choices and consequences. कि देखिए ये कर सकते हैं, अगर आप ये नहीं करेंगे तो आपको ये इसका नुकसान होगा. So it's always good to tell them what is permissible and what is not permissible. So when you are, kind of giving them a consequences, don't give any consequence that you cannot promise. अगर आप बात नहीं मानेंगे ना, मैं उठा के आपको बाहर फेंकवा दूंगा. So you can't do that. So don't do that. So give, reasonable consequences that you think you can do. You have to be really mindful of your non-verbals. So anytime if your non-verbals show that you are, being aggressive and annoyed with them, they're likely to read your, because their focus is on your facial expression. So we have to be aware of your expressions and gestures and movement and tone of voice. So some expressions that are very, not only unhelpful, but they can also aggravate the situation. For example, in anywhere, if your expression, you say, I don't care, or I can't do anything, or what can I do, or that's not my job, they're not desirable kind of, expression. They are going to aggravate the situation. Avoid overreacting, because you can only control one person, and that is yourself. But if you can control yourself, you can manage. So you saw the role play. I did not get angry with what Varsha and Snehal were saying. Even if they were, blaming me, they were arguing with me, they were saying something that was not true. But I kept calm. Mindfully, you have to stay calm. But if you can control that, I think you can handle that situation very, professionally. So you have to remain calm, rational, and professional. And your response will affect their response. So Varsha and Snehal could not be as aggressive as they were with Abhilasha, because they didn't see me reacting, in an aggressive manner. Rather, I could handle, calm them down. And use assertion. Assertion is something that will really help you all through in every situation. Again, some actions that can aggravate the situation. For example, if you start shouting back, if you start banging door, if you throw patient's file, if you call security without any provocation, you are going to aggravate the situation. That's going to, sometimes we call security even at the beginning of the, talking. So they feel threatened that, you're calling security, that means they're going to hit me. So in fear, they might hit you, or they might harm or break things. All through this, please keep a check on the way you are feeling in this situation, because it's important to know what you're thinking or you're feeling. Don't ignore your feeling. If you're scared, if you think you can't handle it, you have to actually, call someone to handle yourself. Know your hot buttons. Sometimes some things are very, trigger this thing. Some situations or some dialogues are very trigger prone. So be aware of your hot buttons. And if you think you can't handle it, please ask for help. Let somebody come and help you. Stage 3 is acting out. The person has already lost control. And we know that person can start hitting us. They may start throwing things. They may damage furniture. Now, this is the time that no logic will work. So you are talking to that person or explaining honestly will not help. I think your response should be safety. Make sure you and those around you are safe. actively activate your emergency procedure, whatever the protocol is. If you have, like you said, code violate, that has to be pressed or call for help. The idea is that make yourself safe and also ask for assistance. And I mean, there's nothing much that you can do beyond that. Stage 4 is tension reduction. When the patient has actually shown their anger and aggression and some time have passed in, usually emotions calm down. There's a possibility that the person may gain rationality. He or she may regret their action, or they may also want to apologize or compromise. Because when police will come in and police will say कि आप पे case होगा, आपको अंदर लेकर जाएंगे, so there will be a realization, oh, I have overdone, I have gone beyond my this thing. So they may want to compromise, or they may want to, make amendments. Although it's very upsetting, very disturbing when you have been, attacked by somebody, or somebody tried to, become aggressive with you. But please remember that this is an opportunity to bring positive change, reconnection, and resolving the issue. Ultimately, I think most of us communicate with the person as they calm down, and we kind of try to find a solution to the problem. So this is stage 4. Once everything is over, don't forget to document. We all know that documenting helps in knowing what exactly happened, how the person behaved, how you handled it, what exactly was the reason, what all you did to mitigate the situation, what was the outcome, what did both parties agree ultimately, what aggravated the situation, what should be done to prevent such situations from future happening. As I said last time also, CAPA is a very wonderful tool. Take corrective action in that situation and take preventive action also to prevent such incidents from happening in future. And then, of course, how you can be reached in case tomorrow if you need to be. So after the situation is over, sit and reflect. See what exactly happened, how you handled it. There's no harm discussing with your colleagues, because they will let you know what are the different ways they handle. That will add to your kitty. Read material to update, attend programs to learn crisis management. It's important now. Each one of us should know how to handle crisis. The last slide is the first slide that I showed you. The carry home message is, please learn to identify people who are likely to become aggressive. Manage them proactively as early as possible to mitigate the situation at the earliest point of time, and handle them with care. You can't say that I don't want to handle. They are there. You have to handle them. Thank you. Any questions about what we have discussed?
It was quite a powerful presentation, actually. Lots of, I think we will have to just sit back and reflect and think, and then probably we come up with questions.
I'm sure. The whole concept is, see, we just handle things extempo. We don't know how to handle. Some of us know how to stay calm. Some of us just don't know. We also become aggressive. We retaliate. We become aggressive and hit people, or we may withdraw from the situation. We may say, that's not my job. Let the management look into it. But once you're caught in a situation and you're alone, you have to manage it. I think each one of us should know how to manage that situation. That's very important. So if there are no questions, I think we will request 2 of our presenters to share their presentation today. So who would like to present first? Dr. Sabyasachi or Dr. Snehal?
You say, ma'am, I'm okay. I can present.
Okay, ladies first. Although it's unfair. Why should ladies have the fun? I hope that's okay with Dr. Sabyasachi.
It's fine.
Thank you. So Dr. Snail, I think I'll switch on the share screen option to you. Okay. So let's have your presentation.
My screen is visible to you?
Yes, it's visible.
Okay. Ma'am, can I start?
Yes, please go ahead.
Yeah. So today's my presentation is on using videos as a way to effective facilitation. So let's take an example of Taj Mahal. I'll just describe in a few sentences. Like a wonder beneath the sky, it stands untouched. The perfect minar, the exquisite design, it is the pinnacle of the art or the symbol of the internal love. Be mesmerized. The incredible Taj Mahal. So this is just a text. So in the next slide, we can the same text along with the picture. So we can the same things like a wonder beneath the sky, it stands untouched, the perfect minars and the exquisite design. It is the pinnacle of the art or the symbol of the internal love. Be mesmerized, the incredible Taj Mahal. So this is along with the picture. This is little more impactful than the text. So now we'll just go ahead with the videos. The same things, but in the video form. My video was having an audio because I was not able to hear anything.
Oh, no, we could not.
I could not hear it.
Okay. I don't know what's happened. What's wrong? Sorry for the technical glitch, and I don't know how to solve it. So, can I just continue with my next slide?
Yes, please go ahead. Yeah, go ahead. Yeah.
Okay. I'm sorry about this, but the actual meaning is if a if a picture is worth 1,000 words, then the video is worth 1,000,000. So video-based pedagogy is an instrumental approach that uses videos as a primary mode of delivering concept. This can include a variety of videos format such as pre-recorded lectures, instructional videos, documentaries, animation, and simulations. So let's compare. If text is difficult to visualize, low attention span, low retention means after 10 to just after a week, it just remains 10 to 15% in our memory. If it is along with the picture, the text plus picture is easier to visualize. Text can be correlated to the picture. Better retention, that means 20 to 30% after a week. And video-based pedagogy is highly impacted, easy to understand, and appreciate, better retention is more than 75% after a week. So where we can use this pedagogy? In case of deep learning is an objective. Aim of the pedagogy is more about imparting skill rather than information. Means, for example, take a live surgeries. In case where the audience attention is challenged, video can keep them engaged. So advantages of this is this facilitates easy understanding, easy to reach wider audience, can be used multiple times, can reach audience in remote location, can be adapted as per the need of the audience. So disadvantages is piracy consent, technical challenges just I faced just now in front of you. So this is the technical challenges in case of poor infrastructure, not a collaborative form of learning. That means it is a unidirectional, and inconsistency is a quality depend on skill of the creator. So let's take do and don'ts. Ensure availability of the infrastructure like internet, screen, etc. Ensure videos have appropriate copyright to prevent misuse. Videos are best used in combination with text and graphics. Avoid using poor quality videos. Avoid taboo topics or politically sensitive content. Not understanding the expectation of the audience, and using legacy videos resulting in disengagement. Sorry, using lengthy videos resulting in disengagement. Thank you.
Thank you, Dr. Snail.
Thank you, ma'am. Sorry for the whatever happened, that technical glitch. That is the major disadvantage of this pedagogy. Yeah.
We have to be really pro at it. We have to be pro at it. When I used to, do my programs in government setup, I had a lot of videos to show to my audience. At number of places, we didn't have the audio system. I used to carry a small speaker with me so that, I could amplify the voice. But I completely understand videos are a wonderful ways to, demonstrate something, especially behavior modification and a lot of other things. Life surgeries, of course, we all know that we get to see. Any question from the audience? Can I request everyone to come in for the last 5-7 minutes? Any questions about the pedagogy?
No, ma'am.
See, the whole idea of having this 10 minutes presentation by each one of us is we become comfortable with these new ways of teaching tools, training tools. So I know you have to make a lot of efforts, take out time from your busy schedule and do this presentation, but it's a very rich learning for all of us. We get to know different aspects of different pedagogy. Thank you, Dr. Snail. It was a wonderful presentation. Thank you.
Thank you, ma'am.
Thank you. So can we have the next presentation by Dr. Sabyasachi? So you can share your screen if you want.
Am I audible, ma'am?
Yes, audible and clear.
Can you see a blank screen?
Yes.
Can everyone see a blank screen?
Yes, we can.
So the last presentation of today's evening is going to start with a blank screen and a story. So this is the story of one of the largest volcanic eruptions in modern history. This is a picture of Mount Tambora, which erupted in April 1815. So Mount Tambora is located in the island world of Indonesia. It spewed 38 cubic miles of ash into the atmosphere and resulted in a lot of loss of lives and livestock. But we are not directly looking at the immediate aftermath of the volcano, but we are looking just a year ahead. We are looking at the summer of 1816. 1816 is widely regarded as a year with no summer. This is actually the temperature map of the entire world in June. The entire map is blue. So what had happened is all that ash had spewed into the atmosphere and had covered the entire world, resulting in a winter for 1 year. So there are multiple paintings which try to capture the ethos of that generation. Here we see midday somewhere in Russia in that time. Here we see midday somewhere else, but perhaps the most iconic painting would be this one, where we see an old farmer stooping down and looking at his ashen crops at noon, and it is still dark and his crops have failed because summer failed to arrive. Now, crop failure has been very common throughout history, but this crop failure was very important because the eruption of Mount Tambora was preceded by a very important historic event, which was Napoleon Bonaparte's failed invasion of Russia. The Russians never really fought Napoleon Bonaparte. So what they did is they gradually retreated from their posts as Napoleon Bonaparte surged forward, and they burnt anything that Napoleon or his army men could have used as food and shelter. Therefore, Napoleon was stranded in the bitter winter of Moscow with nothing. This was known as the scorched earth policy. This happened in 1812-13, and therefore the granaries of Europe were empty, and now we had that crop failure. This led to a massive loss of lives, which is all sad. But then again, that is not where our story is heading. Our story is headed somewhere else. Our story is headed towards this. So all that unrest spewed into the animal world, and horses started dying due to starvation. Millions of horses died, and humans were left with a different sort of a crisis. Remember, in the early part of the 19th century, horses were still the major modes of transport worldwide. So humans now had to find a different mode of transport. And hence, there was the invention of the bicycle. Now, the invention of the bicycle is not, again, our prime interest in the story, but what happened thereafter. So with the invention of the bicycle, there was a relative freedom of association of women. And with gradual relaxation of dress codes and social norms, this proceeded to massive women empowerment. And finally, almost a century later, we had voting rights for women. So this focal physical event, somewhere in a small island in Indonesia, sparked a social change almost a century or two later. And as ophthalmologists, we should be very proud and very thankful that Mount Tambora eruptions happened. Because it is because of this eruption that we were awarded so many empowered women in ophthalmology who have acted as our teachers and as our mentors. And perhaps all of us will agree today, this is the sole reason that we are so awe-inspired at this present moment, and we are trying to learn the nuances of healthcare communication with Dr. Indu Arneja. So thank you for your patient hearing, and I start the facilitation skill presentation, and I will talk about using storytelling in a program. So my route map is a definition of what a story is, where it can be used, its advantages and disadvantages, and finally the do's and don'ts. A story, by definition, is a series of two or more clauses which are temporally oriented. But a story can be infinitely more complex. So where can it be used? A story can be used almost anywhere. It can be used in training programs irrespective of the size of the audience or irrespective of their age. So the rise of podcasts and other media that lend themselves to storytelling have enabled students to interact in new ways with the course material and are actually a modern spin on the age-old art of using storytelling for learning or teaching. So this oft-repeated quote is that humans learn better when content is presented as a story rather than a lecture. And it is really very true. So coming to the advantages and disadvantages, a good story not only provides a temporal orientation, but provides a sense of attachment so that the listeners begin to care. And whenever they begin to care, they focus on the content with obvious beneficial effects on the teacher as well as the course. Whenever a teacher talks about some mistake or error in judgment that he or she has made, it makes them appear human and the course material relevant. And obviously, a story would offer a time-bound logic which can be used as a measure by the trainees to gauge the duration of the course as well as the progress of the story. But remember, storytelling is not all hunky and dory. Whenever an instructor is using story as a pedagogy, he or she should always remember that he is trying to climb up a slippery slope where he has to struggle to remain relevant without becoming boring. There are obvious time constraints to be taken care of, and stories are actually scientifically unreliable. The effectiveness of anecdotes and other qualitative research materials is often viewed very unfavorably compared to other quantitative methods which use statistics. And finally, and most importantly, stories actually require a lot of practice. It is fairly easy to jot down the key points in a PowerPoint, but if you actually plan to use storytelling in one of your seminars, then you not only need to practice the content, but you have to practice the pauses, the jokes, the mannerisms, and even sometimes movement, just as a stage actor does. And a storyteller should always be over prepared, because unlike a stage actor, he or she might have to address some tangential question which he or she would have to answer. And whenever the story is going astray, he will always have to keep a back door open to come back to the main topic. Coming to the do's and don'ts, I have used visuals in the story, but it is not always necessary to use visuals, but it is essential that one appeals to more than one sense. That means that while narrating the story, it is useful that one uses words or clauses which refer to a different sense, such as the sense of taste or the sense of touch. And one should always avoid using jargon or technical terms. It is best that one knows one's audience rather than focusing on oneself. It is best that one is honest. If while storytelling, the instructor paints too perfect a character, then it loses credibility and there should never be holes in the plot. One should always go deep to maintain interest and never skim over details. One should try to make it useful. I understand that when an instructor is trying to narrate a story, there is always that vested interest of selling an idea, but one must never try to sell the agenda too hard. And a good story is one which always leaves some room for imagination without overcomplicating. Before finishing, I'll just want to say one more thing. I personally am an avid collector of stories. So when I hope to meet all of you in Kochi conference next one, and when I meet, I would love to hear at least one story from each one of you. Thank you.
Thank you so much, Dr. Sabyasachi. Can you stop sharing the screen? Thank you so much. You seem to have done a lot of effort you have put into do your presentation. That's visible in your work.
Thank you, madam.
I'm very glad that you took it very seriously. And of course, everybody has put in their effort, but your presentation was really very nice, very full of efforts, I can say. Any questions if anybody wants to ask Dr. Sabyasachi about the pedagogy? Thank you so much. I think it was a wonderful presentation. So if there are no questions, I'm pasting the link for the feedback form. The feedback is only for the presentation, sorry, only for the topic that we have covered today and not on the presentation by the presenter. Please go ahead and give your feedback. Thank you. I think I have received all responses. Thank you so much. Can we close the session?
Yeah. Thank you, ma'am.
And we meet, I think, on Monday, 17th.
Yes.
Yes,
Okay.
ma'am.
Thank you. Thank you, everyone.
Thank you so much.